Go ahead.
You talked about the primary healthcare center being the weakest link, it would seem, in all of this. What would be your support then for the, because if you're building so many primary healthcare centers and you're saying that within the radius of 5 kilometers, there must be a primary healthcare center, yet you have the deficiency of manpower where, local governments cannot afford to sometimes take on all of this, possibly because of, whatever is happening with the salaries of medical personnel. What is your input into helping that basic unit, which is where people should primarily receive healthcare from?
Thank you. We're trying to look at what we call primary healthcare center under one roof. We have a primary healthcare development agency, which is a state body, which ought to and is doing that, overlook the entire primary healthcare centers in the state. And there is a memo to that effect that doctors should be employed at the central level under the agency, so that these doctors will now be dispersed to the primary healthcare centers. They can take their turn in actually ensuring. The same thing with nurses. These nurses and these doctors will be directly from the state government, but overlooking and giving further support to the local government staff. And so these doctors can consult, the nurses can work in these places. It's on that's the plan. And we feel that will go a long way in assisting.
What will be more the thrust of policy in terms of healthcare? Will it be more preventive or more curative, or is it a balance of both? And if it's more preventive, what other agencies are you working with to ensure that you prevent some of the diseases that could even get people in hospitals in the first instance?
Well, the basic thing should actually be we're striving to get it more preventive than more curative. But no matter how much we do in trying to sleep under mosquito nets, mosquito treated nets, insecticide treated nets, and the rest, we still know that a lot of people will come down with illnesses, and they will need the attention of the doctors. So our attention is based. That's why we're talking about immunization in primary health care, to ensure that children immunized does not eventually come up with the ailment. But inadvertently, they also, one way or the other, still either for one reason or the other. Then two, the malaria control preventive this thing in Nigeria, presently in Delta. Recently, we distributed close to 1 million insecticide treated net, which the people, again, we have to talk and ensure that people sleep under this net. In spite of people sleeping under insecticide treated nets and all that, they still come out with. So it's more of a balance, more of preventive, but at the end of the day, there's still a spillover from people who are actually preventing, giving them good clean water to drink to prevent cholera, ensuring that there is water, potable water in all the villages and communities, so that people don't get, but one way or the other, people still come down with it, and so the curative aspect come into being.
Okay, if I may follow up on that policy, what kind of results is this policy hosting with respect to maternal death?
Thank you. Let me talk about Delta, because I know that the figures at the national may not be too encouraging. Presently, even when it used to be like 800, maternal mortality at the federal level was 800 per 100,000 deliveries. Here in Delta, before 2007, the figures were like 450 per 100,000 deliveries. But since we started the free maternal health care program in 2007, and with a lot of pregnant women now having access without paying a kobo, free treatment from the time of inception in the hospital, free laboratory investigation, free drugs, and even when we have to do cesarean section and vaginal delivery. It's free of charge. The maternal mortality has reduced drastically to about 241 per 100,000 deliveries. So we've been able to move to reduce maternal mortality by over 50% since we started the program. Quoting the figure as it is in 2012, the 2013 figure may even be lower than what you're quoting.
Would you say that you've recorded your greatest success in maternal and child mortality? Reducing it, that is.
Yeah, I should think we have made more successes with the maternal mortality than the child mortality. We've done a lot with regard to the child. Yes, the access is there for everybody now. Children between the ages of 1 to 5 years can come to our hospital, particularly the secondary hospital, 65 government hospital, and access free treatment when they are ill. Also, when the child is delivered and he needs to be put in the incubator, being a premature child, he has all that, access to be put until in our government hospital, not the tertiary hospital. But we have recorded more success with the maternal mortality than under 5 mortality. The two are going well in terms of reduction, but we have recorded more success with maternal mortality.
All right, Dr. Joseph Otuma, Commissioner for Health in Delta State, thank you for coming on this one.
Thank you.
All right, now we'll return in just a moment. Please join us again.